Hello, my name is Maria Howard and I'm the CEO of the Alzheimer's Society of BC. On behalf of the Alzheimer's Society of BC, a big welcome to everyone today who is watching this conference. It is wonderful to be here and help facilitate the BC Care Providers panel and conference on such a great conversation. Today's panel is going to be learnings from the home health sector. The Alzheimer's Society of BC's vision is a world without dementia, without Alzheimer's. And that begins in a province that does see people with dementia in an acknowledged way, in a safe way, in a caring and inclusive way. We know that there are over 70,000 people in our province who live with dementia. And we know that for them, it's important to live and journey through their experiences in the place that is most comfortable and safe for them. Today in our discussion on learnings from the home health sector, we are going to explore those ideas and the learnings that have come from COVID and how experts in the area have experienced it and have taken the lessons that they have learned and continue to apply that. I would like to introduce the panel that we have here today with us, who are experts from across our province who have lots to offer. Jennifer Lyle, CEO of Safe Care BC. Thank you and welcome for joining us. Jay Orosa, CEO, Home Care Assistants, Greater Vancouver. Welcome, Jay. Maureen Charlebois, Chief Nursing Officer, Bayshore Healthcare. And last but certainly not least, James Chalman, CEO, Greater Vancouver Community Services Society. Today, as we go through the panel, we are going to ask our panels to share some learnings from their experience over the past 3 months of living through COVID. And we're also going to have a really exciting conversation with some really key questions. I would invite each of you, as you're watching today, if you have questions, to share that through the chat pod, and we will be taking questions and answers as we work through the session. So first, I'd like to start with you, Jennifer. Can you share with us some learnings that you've had in these last few months through COVID?
Yeah, thank you, Maria. And I think it goes without saying that these past few months have been extraordinarily challenging for everybody who works in the healthcare sector, in the community social services sector, just across the board. So I really want to acknowledge and thank everybody for all their incredible work that they put in over these past few months. It's no small feat. I think reflecting on the events over these past few months, there's probably about 4 different themes that come to mind. First and foremost is obviously the major challenges we faced across the province and arguably across the world with regards to personal protective equipment, or PPE. And in the home health sector, this was really felt quite acutely. And we saw this we've done about 4 surveys to this point now on PPE snapshots. And we see a theme emerging with regards to that, the struggles that home health operators have had in terms of securing reliable medical grade PPE, but also too, just in terms of the outreach that we've been doing and the fact that initially when this pandemic was starting and for many months going into it, there wasn't any federal or provincial backstop for home health operators who had exhausted their PPE supply chains. And that put them in an incredibly stressful position and arguably an unsafe position. And so part of our response at Safe Care BC included Operation Protect to help act as a stopgap in that measure. But, it still took several months before we started to see those provincial supports and those federal supports come online. And that's something that I think is definitely a key takeaway for this pandemic, is that our pandemic response absolutely needs to take into consideration a wider lens when it comes to PPE support. It can't just be focused in on, the acute care sites, long-term care, assisted living. I think that kind of ties into the next point around communication. And that was one of the challenges, again, that we saw coming forward in the pandemic, particularly in the early months, but still ongoing. It's really difficult as a small home health operator, or arguably even some of the larger home health operators, to get reliable information, guidelines, and direction on infection prevention control, especially in those early days. Because what ended up happening is a lot of the guidance documents that were being put out there really focused in on the infection prevention control measures in the acute care sector, and then later in long-term care and assisted living. But home health really wasn't part of that conversation at the outset. And that led to a lot of regional differences in terms of what guidance people were following, the practices they had around PPE. And it also led to confusion, particularly with some public health orders, for example, around the single site staffing order. That caused a lot of confusion in the home health sector. And so our role really at Safe Care was focused on acting as a clearinghouse of reliable, simple information that people needed so that they could operate safely and make informed, educated decisions about what changes they needed to make within their home health operations. It also kind of speaks to the larger issues that we saw. And again, this is really the lessons learned on this one, is that the pandemic strategy at the outset was really very acute care focused, arguably looking at protecting acute care bed capacity initially. It was later expanded to incorporate a bigger focus on long-term care, as we saw where the outbreaks started to occur, and unfortunately the infections and deaths. But again, home health was still left outside of that discussion in many ways. And I think that's something that we need to take forward into our next response in terms of where home health fits in the overall pandemic response, because it plays an important role in terms of helping relieve the stress on the acute care system, on the long-term care system, and also too just assisting people in aging in place where their preference is. So those are kind of some of the key things. And then I guess the last one, which, I'd be remiss if I didn't mention it, this pandemic has had a huge impact on people mentally and psychologically. And I think, we need to be very careful and mindful that we are aware of what's happened and that we address and provide those wraparound supports for people through this period so that they don't experience burnout and that they don't end up leaving their field of choice because they are burned out and they're tired. And I think that's why initiatives like Care for Caregivers is so important. But I think there's so much more that we could do in that front. So a lot of lessons to be learned from this. And I think overall BC has done a good job of learning those lessons, at least, over as time has gone by. But that's certainly something that we have to improve upon going forward when we look at a potential, what's coming down the pipes in terms of the fall as well as next year.
Thank you, Jennifer. Certainly Safe Care BC has been such a major player in helping in so many ways over the last few months. Thank you so much for that. Jay, I'd like to turn it over to you. Can you share some of your learnings as a small operator?
Certainly, Maria, and thanks for the opportunity to share this. I'm going to be repeating a number of what Jen has mentioned, as I'm sure some of the other panelists will. I do echo her sentiments, though, that I think, when thinking about everything that has just transpired with, COVID-19, I mean, as a province, as an industry, I think we did, quite well considering everything that's going on around us. However, there's certainly a number of challenges that we can learn from, and hopefully, if we do end up facing anything like this again, certainly leading up into the fall with the second wave, we're able to maybe take some of those learnings and make adjustments. So the way I've organized my time essentially is to talk about some of the challenges we faced during COVID in the earlier days, and then some of the things we put together in place to help us rise up to the challenge and kind of manage through it. Then hopefully what we can do moving forward. So speaking specifically about private home care, I like to think about things as sort of like a bit of a matrix. So you have in our healthcare system, you have the public healthcare that's provided. Then you also have privately provided healthcare support. And then within those lines, you have kind of both sides where you have kind of residential healthcare, but then you have home health or private, both public and private home health. So the industry I represent is the private home healthcare sector. And a number of the challenges we faced early on, just like Jen had mentioned, was that single site announcement or single employer rule early on. There was, certainly early, there was a little bit of confusion around that. And as clarity came about, there still was some challenges in terms of restrictions of where people could work. I'm not sure if, the rest in the panel or, all of you folks out there know, but in our industry, it's not uncommon for one worker, a care aide, to be working for one private home care, more than one private home care agency. In some cases, they might be working for up to 2 or 3, kind of like dividing their time between 3 and sometimes going into different residences. So you can imagine what sort of some of those challenges were once that announcement was made, being able to kind of just coordinate and put together a process to make sure that you're limiting the amount of sites that workers going into and adhering to the policies. So in turning back to that matrix that I discussed, so I think everyone during this period was glued on to a lot of what Bonnie Henry was announcing almost on a daily basis, and there was lots of really good direction given to the province and to the healthcare system and people in general. But then obviously the interpretation of that as it boils down to private home care was quite difficult. So you see a lot of different interpretations and confusion. One of the other challenges that was faced certainly was the staffing challenge as well. We per se, our business fortunately did not get impacted too much by some of the early challenges around people or care aides not wanting to go in to work. We're blessed to have people that really are committed to providing care for seniors. And they were coming in, but I do know a lot of my colleagues in this industry were struggling. And one of the things I think that was introduced early by the federal government was obviously the hero pay. And while I think it was good to be able to act on things, there certainly was in I guess in our opinion maybe different ways they could have done that in order to encourage people to continue their work with seniors. And then the final thing around challenges that we really faced was the PPE supply. I'm not going to go over it as much because Jen already mentioned quite a bit of it. What are some of the things that we did or during the pandemic? I mean, one of the things that we found helped us really was being able to organize ourselves virtually. Having people rotate in the office, come in. We have a back office that supports all of our caregivers. And as you can imagine, with the staffing demands, we've had to, continue to recruit people. We've had to find ways to interview and recruit and hire people virtually in many cases. And I found that the providers that were able to kind of spring forward and have some type of virtual infrastructure, if you will, were the ones that were able to kind of ride out the early day challenges of the pandemic. In terms of what things we can hope for moving forward, especially for the government, so recognition of private home care, I think, is extremely important. Private home care has such an important role to play, whether it be in facility or retirement residence arena, or whether it be private home care support in a senior's residence. We have such an important role to play in keeping seniors out of the public system as much as possible. So it would be really nice to see, when the government, and again, I do applaud the federal and provincial government for really responding to the need, but I'd love to see really more recognition around the role that private home care plays, both not just from a guidance standpoint, but also from a support standpoint, be it staffing, staff pay, or even PPE supply. So that's essentially it. Happy to, I guess, address any other questions later on.
Thank you, Jay. It sounds like your organization really stood up to many challenges early on and really began to see how you could address the issues immediately. Maureen, Bayshore is a large national organization. I would love to hear the learnings from yourself.
Yes, well, thank you very much, and thank you for having me on the panel. And I would like to also acknowledge the outstanding leadership that British Columbia demonstrated at the outset of the pandemic. I was actually in Kelowna, BC, at Big White, what I thought was going to be a vacation, the first week of March, where I found myself actually setting up my own little command center in the chalet. And with that, I was able to hear from Dr. Bonnie Henry and her team on the news. And what amazed me was that next day, I would see the direction actually being implemented. And it was very encouraging, and it actually made, my family and myself feel safe. At first we said, okay, why are they shutting down the children's area? Because we had to. And that's what I want to talk to you about today, just regarding the importance of acting early with clear direction and purpose, having a relentless focus on patient and staff safety, especially when challenged, and addressing everyone's fears through communication and ongoing engagement at all levels of the organization. And as we've heard from our two previous colleagues, that the reality is that through this pandemic, home care was the forgotten sector. As mentioned, I am the Chief Nursing and Clinical Officer at Bayshore Healthcare, and we are one of the country's leading providers of home and community healthcare services across Canada. We have over 13,000 staff, and we provide care to over 250,000 clients. And, I've been in healthcare over 30 years, and I'm very, very committed to person-centered, integrated healthcare system. Unfortunately, the COVID-19 pandemic planning was not approached as a system, but rather by a siloed sector approach. So, why does this matter? Well, we know that when one part of the system fails, the other parts of the system are impacted. And more so, unlike SARS, COVID-19 has community spread. So it was even more critical that the needs of home care were addressed. Unfortunately, they were not. And we need to now take this opportunity to fix the flaws of the system that COVID made visible, such as the over-reliance on the hospital sector, underutilization of primary care and home health care, and lack of early attention to all vulnerable populations, and the devastating effects of institutionalized care. So what did we do? Well, in January, when I first started hearing about this SARS-like coronavirus from Wuhan, China, two of the areas that we immediately looked into were our PPE and our existing infection prevention practices. So to start to prepare the organization, as you can imagine, quite challenging because we're across the country, so dealing with many different provinces and governments, we started to do what we knew best, and that was to enhance our safety education regarding the importance of increased household and facility cleaning, having stringent hand hygiene, and to start patient and staff self-screening before every visit, as well as increased communication and engagement. And even before the World Health Organization declared COVID-19 a global pandemic, we had implemented enhanced precautionary safety measures and evolved our virtual care services. Our safety of staff and our patients were always our top priority, and this certainly proved to be a godsend because home care is safe and we have had zero spread. In addition, when public policy was implemented to have all citizens to self-isolate back in March, when they traveled outside of Canada, we had to enhance our COVID-19 guidelines to include healthcare providers to wear full PPE if a patient had one of their household members on self-isolation, and not, this wasn't thought of at the time and no guidance was given. And similarly, when we assessed the risk of our healthcare providers was increased due to COVID-19 community spread, we increased our safety measures to include all healthcare providers to wear masks, regardless if their patient screened COVID positive or not. And as weeks went on, I could certainly start to see the additional stress and fear from both our staff and our patients. So in response, we developed a PPE safety mentorship program with the goal of zero preventable harm. As we know, PPE are the most critical tools for healthcare providers in keeping themselves safe and their patients. And during this pandemic, quite frankly, getting the PPE has been very difficult. But I was so proud to see that in May, when we did a survey of our healthcare providers, 92% felt supported by their managers to provide care safely, and 98% of our healthcare providers know when to use PPE and how to properly don and doff PPE, which was just fantastic. So now, as we head into the influenza season and high anxieties as we're seeing increasing COVID-19 cases popping up across the country, we are prepared, and we will continue to take every precaution necessary to care for our patients and our families while providing a safe environment for our staff. And it certainly is the resiliency, courage, and compassion of our healthcare providers that really continues to fuel my energy. So by continue to work together, and through the extraordinary efforts of our healthcare providers, the continued support of our government, our healthcare partners, and learning, and we have to learn from this first wave, we will build a better integrated person-centered care system and what is necessary to mitigate the effects of this pandemic and eventually defeat it. In closing, really, as Winston Churchill once said, never let a good crisis go to waste. So we must learn from what we have experienced and build a better system. Thank you.
Thank you, Maureen. What a great quote. And it's great to hear how quickly Bayshore put safety at the top of its priority list. James, what are your learnings about communications and PPEs?
Thanks, Maria. I guess before I get into that first, I just wanted to also extend my sincere thanks and gratitude to all of our employees of GVCSS who came together and in a cohesive manner with a focus on the clients, because that was primarily what we needed to happen. There's probably three main learnings that we came up with at GVCSS. And first of all was the need for advanced readiness of the organization, and that around PPE primarily. The second was the ability to quickly respond as changes occurred. And the third was for the requirement for positive internal and external communication. In regards to that advanced readiness, just like a lot of organizations have emergency preparedness kits and that for a tsunami or whatever, the ability for us to have a stock of PPE in place already. Fortunately for us, we had a number of gloves and some masks in that. But again, where we saw that the biggest learning there was around the requirement to have stockpiled not just of those basic things, but some of the other items that we needed of the PPE. Also, within that readiness was one of the things that we did have ability was for our schedulers and admin to work remotely, which was huge. In Vancouver, we provide about service to about 4,000 people publicly and privately through home care, with about 650 of our home care staff, direct service staff. So for them to work remotely and keep in contact was huge for us, and so our ability to do that was large. And in order to do that was the need for our internal integrated communication system for that fast response, which leads into the second thing, which is the quick response as changes occurred. We had to be flexible, and definitely we saw the need to be flexible, and having that ability for leadership to obtain information, respond back to our front line in a timely manner that assisted them in their work. We also needed the ability to align the holes. For one of the things that we found was that we had a number of staff who went away on COVID leaves for a variety of reasons, whether that was their own fear, or whether they had family members who are at risk, or they were at risk, or whatever. So we had a number of those staff call in and say, not going to make it, or as was mentioned before, as they working in another facility, couldn't work for us. We also, on the other side, had clients who stopped service because of their fears and the possibility of COVID transmission. Unfortunately, those holes didn't line up where our staff were taking time off and where the clientele were saying they didn't need service, that, like I said, didn't line up. So our ability to line up those holes and move staff and have that be flexible there was huge. And again, for our scheduling to be flexible is a big learning aspect. The last part of that quick response was around pre-existing relationships. And it was huge, especially in gathering that PPE. Our relationship with the public funders, with the Vancouver Coastal Health, and with private PPE companies, in order to obtain it in a timely manner, that was again large. So, and just as we know in this field, relationships and interrelationships are such a large aspect, and so that was definitely a confirmation of the need for that. The third area was that positive internal and external communication. As noted, there's the number of ways that people were getting information, whether it was from Dr. Bonnie Henry, or from the Canadian Medical Officer, the U.S., throughout the world, the World Health Organization. So people were being inundated with information. And so we found was really important for us was to funnel down that information, synthesize it, consolidate it, and get information back out to our staff and to the clientele to try to minimize their fears, and so that that people felt like, okay, they've got a control on this. So that communication, like I said, whether that was internal and right from myself to the senior leadership team to our supervisors, schedulers, and right to the frontline staff, was huge. And again, like I said, to the clients and any public that saw our messaging was again large. I think that's about what covers my topic items. If there's any other questions out there, I'm hoping to take them.
Thank you, James, and thank you for highlighting the importance of relationships and communication and the necessity of getting information out to everyone as we were all trying to figure out the first few months, and then as we go into beyond to what is coming next. As I reflect upon the learnings that you've been sharing, and thank you so much, it really is indicative of a sector that puts their staff and their clientele so much at the front and continues to ensure that services are in place despite all the challenges. It makes me think about many of the families that the Alzheimer's Society of BC connects with, and how important for people who are on their dementia journey while they're living at home to have the support they can to feel safe there and to feel like things are under control. And the support that home health gives to those families, whether it's the individual with dementia or it is the care partner, is so invaluable. And so again, I just thank you all for your commitment to that, which you truly are doing. I'd like to move into some questions, and I'm going to start with Jen, but I think it's a question that you really have all touched on in a different way. And I'm curious, we talk about the psychological health and safety of our staff and how that is so important, and especially during COVID-19. I'm curious, is the way we approach that for staff in the home health sector different than in other sectors? Jen, would you like to start with that?
Sure, yeah. And I think, I guess first off, I'm really happy to hear that we're talking about this because, it's incredibly important that we remember we need to protect and talk about people's physical safety. Yes, absolutely, but also their psychological safety. So, the home health sector has some interesting challenges that, require us to take a bit of a different approach than you would in, say, for example, long-term care setting or an acute care setting. First and foremost, we're talking about a workforce that's largely decentralized. So, they may go, in some cases, they may go days without seeing anybody from their office, and they'll be interacting through, the phone or through another device. So there's not a lot of opportunity for those informal peer support moments. You have to be much more deliberate in how you manufacture those and create opportunity for that peer support. And that peer support is so incredibly important when you're going through a really trying time. There's a lot of really interesting research that's been done with the armed forces, also being done in acute care settings, this concept of having a battle buddy, if you will, or somebody who you can talk to and just say, hey, I'm going through this, I need to vent a little bit. That has a psychologically protective effect. And so That's what we were trying to get at with the Care to Speak initiative that we did in partnership with the Canadian Mental Health Association, was to create that virtually for people who are, perhaps working in that environment where they don't have those opportunities to run into a colleague in the hallway and say, oh, hey, how are you doing? Oh man, my kids are driving me nuts. They've been doing homeschooling for months and they're driving me up the wall. That stuff is important, even if it seems trivial. So I think we have to be mindful of the uniqueness of the home health sector when we're talking about how we go about designing our psychological health and safety strategies. I think it's also important too to remember, and this is maybe where home health is not unique, in that the majority of the workforce is female. The majority of them are generally middle-aged. So you have women who have kids at home, so they have family obligations on top of this. They may be experiencing anxiety around, I don't want to be the one to expose my family members to COVID. And I also don't want to be the one to expose my clients to any potential infections I'm bringing from the community as well. So I think we need to also be mindful of people's whole persons when we're talking about providing those psychological health and safety supports. And, it's important. One of our member surveys we did in the summer, we asked the question, are you more or less likely to be still working in the next year? Because we wanted to know. And what was interesting is the vast majority said, yeah, my plans haven't changed, or I'm more committed than ever. But there was 10% that said, I am less likely to still be working in this field in 12 months. And the primary reason they cited was burnout. So that's really underscores the importance of addressing this issue.
Thanks, Jen. Does anyone else have a comment on that?
Yeah, I think that Jen really hit that in the right area. There is around that isolation that not only the clientele, a lot of the seniors we work with are very isolated and they need to feel connected. But yeah, our workers are out there in the field, and their connection sometimes only through a cell phone to the main office or through the organization. And a lot of the feelings that she mentioned about taking possibly COVID back to family or to the clients was very real. And it was really important that we focused on that for their well-being and for them feeling like that they were supported in that. So that the huge area of feeling of support for our staff.
Maureen, have you seen any similarity running a large national organization in respect to that?
Oh, absolutely. And I was just going to echo all of those comments and then just add that one of the reasons why we actually implemented the PPE safety mentorship program was for that better psychological support. At first, many of our healthcare workers, nurses, PSWs, they said, well, geez, we know how to use PPE. We've been doing this all the time. But what was different this time? We're in a pandemic. People were tired and burned out, and they were afraid. And so this additional safety check just made them feel more confident. And as well, our clients, our patients, they felt at first very fearful of the unknown, as we all did. I remember, even my first time going out shopping, as an example, you're wearing a mask. And you were afraid. So imagine caring for the sick and vulnerable elderly people, but they actually felt safer when they were part of what was going on and around the PPE and why it was important. And so that really is all a part of our full quadruple aim quality management framework, to really focus on both the well-being of our patients, but as well of our staff.
Thank you, Maureen. That leads nicely into the next question, which really is around supporting staff and clients, and that sort of relentless way that many of you started your response to COVID-19, and how you quickly worked with many partners and through your relationships to have appropriate supports in place and different ways to manage things. And it took a lot of energy, I can only imagine. And people were, as all of you have shared, were anxious, were nervous, were frightened. But through a relentless approach, many changes have been put in place to manage. But as COVID continues, as we move into the fall, how do we keep up that approach, that relentless approach? And I think the new expression I've heard is pandemic fatigue. How do we prevent that from happening and beginning to lose a little bit of the edge? Maureen.
Yeah, sure, I could start. And I think even more so with the fatigue, and people are tired. Sometimes it's easier to give up than to stay the course. And so it's very, very important that we do that. I remember the early days, all of a sudden I was implementing different policies and protocols to guide practice, and it was being implemented within minutes. And yet people didn't have time to really even absorb them because it was happening so fast. And then boom, by 10 o'clock that night, I had to put in other protocols. And so I, got a lot of pushback. I will say those words, both internally and as well. A lot of our senior leaders then, they were dealing with different provinces that maybe weren't where we were at yet, because we had to act quickly. And so, of course, they then were getting the pushback from their province, and then they would then have the dialogue internally. And so many nights it probably was easier to say, I give up, fine, we're not going to do this, but we couldn't, for the safety of our staff and for the safety of our clients. So even more so, we have to be aware that when people are fatigued, that we need to stay focused on the number one priority, and that's safety of our patients and of our staff.
Thank you. Jay, any thoughts on that?
Yeah, I was just going to share. I mean, personally, our experience, and I think back to one example prior to COVID, and I have to give credit to my wife, who's our COO, and she runs our operations. But during the transit strike that we encountered sometime last year, I saw how she was able to mobilize her team and get really prepared for what was going to happen should many of our care aides not be able to make it to the homes of clients through public transit. And they had a system in place. And I saw that same system or same way of coming together and just being prepared and planning ahead come into play during COVID. And my message, I guess, to any private home care provider out there is, you talk about COVID fatigue. What it is really is it's putting out a lot of fires. It's a lot of unexpected things that could potentially go sideways and go wrong. And really the only thing you can do, at least leading into it, is plan for multiple scenarios as far in advance, whether it's stocking up on PPE, having more than, if you had one or two suppliers before, make sure you have contact with 5. Make sure that you have some backup plan in place should none of your back office staff be able to enter the office. Hopefully for a lot of people, this situation has been able to get people to think about being able to manage things again virtually or remotely. So those are just some of the things I can think about, maybe as it pertains to being able to avoid some of the COVID fatigue. The last thing I'll share is that as you pointed out, I mean, we're like a small, medium type provider. When you look at the private home care space, if you look at small to medium sized providers in the province, I think in the last count there was over 120 or 150 providers, and again, this comprised the very small, one person or small mom and pop operations all the way to the larger operators. So that being said, I think the closest thing we have to kind of like a unified association, if you will, is the BC Care Providers Association. And I think James made the comment earlier that in the early days, everyone was turning to, whether it be Bonnie Henry or our federal, minister or medical director there, or even the US, in terms of guidelines. And when private home care gets left out, then everyone starts to do their own thing. And I found it extremely useful to be able to turn to the BC Care Provider Association to share with them some of our successes. What are we doing? Try to find out what some of the other people are doing as well. Because shared successes, shared experience, I think is the best we can get to during times like these to help each other learn and prepare.
Thank you, Jay. James, from your organization's point of view, what about pandemic fatigue and how to remain relentless?
Yeah. And relentless almost is a misnomer because, people feel inundated, I think, with a lot of the information that they receive. And then, as Jay mentioned, there's so many sources. And that's something we have to be careful of, that we don't inundate the clients or the staff with one more piece of information. I know we had a lot, even as an organization, we had a lot of different sources providing us input and giving us updates from this provincial organization or that federal organization. And it was all very helpful, but even from us as professionals, we felt inundated with all that information. And so we had to take care not to pass that along to our staff and to our clients. And so, really that balance to provide information, but not to inundate them.
Thanks, James. I just want to go back to Jay and ask you a question. You referenced a few minutes ago about size and the small organizations in the home health sector. And I'd be curious just to explore that a little bit more about what is the difference of the size of smaller organizations in the sector, and how does that influence in how you're responding to COVID-19?
Absolutely. It's a good question, Maria, because I think, we're all in the healthcare space. So, the challenges we face, such as COVID, are going to be the same all throughout. But then our ability to manage that and respond to it, and also just different challenges are going to be different for each provider, primarily because of size. One example of this is, and I say this because scale in this industry really matters. So one example is, I think someone had mentioned earlier about some folks pausing services for caring for their parents because they themselves, had taken time off of work. Well, if you're a small provider and you're just working with, let's say, a dozen families, and that's essentially keeping your business afloat. Well, if half of those families all of a sudden, took a break and started caring for their seniors, then, you're 50% down on your revenue. It's very difficult to move forward from there and provide a livelihood. So that could be one of the challenges of some of the smaller operators. But as it pertains to another thing that was discussed earlier in terms of support. So, providing private home care, in itself is quite a siloed space, as we've been discussing. But if you think about our providers, the care aides themselves, this can be a very lonely job. And, one of the things that we've found really helps support the care aide in terms of the senior care that they're providing, considering it's such a lonely job, is the more we're able to provide guidance, check in with them, and provide them with support from, from a supervisor. In our particular case, we have a private case management model where we have case managers looking after our caregivers and supporting them. But this is something you can only get to when you have a certain amount of scale in your business. If you're just serving, let's say, 20 or 30, families and their parents, it's very difficult to have that kind of back office support to provide that higher level of support. And then there's other things like hiring and training. If you're a smaller operation, what you'll find is that sometimes, whether you're an owner, operator, or you have 2-3 people in the office, people are wearing multiple hats, having to do all of this. So even outside of a pandemic, it can be a pretty challenging and daunting industry to be in, especially if you don't have kind of that scale. So that's all I can think of in terms of how maybe some of the smaller providers can get impacted. One of the benefits or advantages, though, that maybe some of the smaller and medium-sized operators do have is just having the ability to be nimble. I think Maureen was mentioning earlier, and you can correct me if I'm wrong, Maureen, and sorry if I misstated, but one of the difficulties is when you're a larger organization is whether it's getting approval from people or agreement or alignment from people up top. Well, if you're a smaller or medium-sized organization, usually there's just like 1 or 2 people making the final decision, and they hear about it like 15 minutes later. So they have that ability to adapt and be flexible to the changing times. So really, it's a whole mix of different challenges and advantages on depending on size and scale.
Thanks, Jay. Any thoughts about that, Maureen?
No, you're correct in what I was saying. It's I think whether you're small or large, the complexity that you were dealing with before the pandemic even becomes more visible when you're in a pandemic. And a lot of times, you are flying at your on your seat, whatever that saying is, to make the best decision. And depending on, as we are a large organization, we have a lot of senior leaders in our organization that we need to work with, as well as we're dealing with a lot of external partners and government agency. And you can imagine not one province wasn't always rowing in the same direction, let alone when you're dealing with multiple. So it just added to the complexity and the sense of urgency of putting in the correct policies and procedures to govern the best possible care and management of your staff and their patients.
Thanks, Maureen. Jen, do you have one last final comment on this question?
Yeah, I was just reflecting on Jay talking about the challenges you have as a small to medium organization and the fact that you typically have a really lean structure. I think that's one of the things that we really understand. We recognize at Safe Care BC, particularly from the workplace health and safety side of things. We know that small organizations don't have an OHS department. They don't have a workplace health and safety department. They have one person who's doing it as one small sliver of their job. And so in general, but particularly when you're talking about a pandemic, our job as a safety association is to step in and support you so that if you're trying to hunt down resources, if you're trying to find the guidance documents, you're trying to develop those policies and procedures, you know that you can, so that we can support you. And so, I sincerely hope that everybody takes me up on that offer if you're watching this panel discussion, but we are really here to support you. And we just recognize the challenges that smaller organizations have because of the fact they have such a leaner structure when it comes to this sort of stuff.
Thanks, Jen. Great ask to everybody. Just as we get near the end of the panel, I'd like to ask one final question. And James, I'm going to direct that to you. And earlier in the conversation, you had commented on schedulers and administration and how the importance to support those individuals who are working remotely. Just would love to hear a little bit more about that.
Thanks, Maria. I guess as a regional not-for-profit organization who provides support in the greater Vancouver area, we kind of had we got the best of both worlds, just in reference to that last aspect about size, to where we're large enough that we can we don't depend on just 6 or 12 individuals receiving service. So if there's some flexibility there, but and with 650 staff we can maneuver them, but also that we have a large enough or we have a small enough leadership team that we can make decisions quickly. One of the benefits that we had is we did have the ability for our schedulers to work remotely, so that when the issue around not feeling safe to come in, we could address that and say, okay, laptops could go in through the VPN and do scheduling, and they could see all of the information that they needed in order to continue doing their jobs. And so the challenge then became to keep them connected so that they just weren't sitting at home doing their job, but having no connection to anyone else. So that was the challenge for us more so, was to keep all of the supervisors connected and keep us all rowing in the same directions, as Maureen used that analogy. But and make sure we were consistent in our services, and if we needed to borrow staff, so that one scheduler could have that communication with the next scheduler around borrowing from their area, because they may needed more people because of shortage of staffing, and some of their clients weren't canceling their services. So it's not just the ability to work remotely, but also keep connected. Video conferencing, we utilize that, and it's come into its own these days, and we see that. And thankfully, we were able to take that and use that to our advantage.
Thanks, James. Maureen, what has Bayshore's experience been with that same area?
Sorry, with which?
With schedulers and administrative working remotely?
Well, yes. So most of our staff all of a sudden woke up in their homes with a house full of children and other unwanted guests, I'm sure, to try to do their job. And so in our pre-planning for the pandemic, we actually had started to develop some enabling policies and procedures to make that possible. One of the areas that we certainly saw as this was very new to staff was that feeling of isolation and not being connected. And they too, all of a sudden, as I said, they woke up in a new world. They were concerned of the future. And so that's where we really had to continue to do a lot of great communications and engagement and look at other ways of connecting with our staff at various different levels. So we had implemented town halls actually on a weekly basis. We had a leaders weekly huddle. We had a COVID-19 IPAC weekly huddle, and then we had various different chats throughout the day from the individual leaders. So it was really looking at new ways of business continuity. And I must congratulate all staff and all team members. They've done an outstanding job. And as I said, it was really their continued compassion and courage to work through this pandemic to make it possible for we could continue delivering the services to our clients and our families and to support one another. So I was really really warmed by their behaviors and sense of commitment and compassion for everything that they were doing. It's amazing. It's amazing what COVID has done, right? I think it really has strengthened collaboration and partnerships, both within our organization and externally. So, I mean, there's always positives that come out of this, and it's amazing how resilient and strong the human person is.
Absolutely. Jay, any additional comments?
Not too much more beyond the scheduling piece. I mean, we experienced early on, again, not a lot of people wanting to come into the office because of what the whole scare of COVID. Then eventually we developed sort of a bit of a rotational period where two people could come in at a time, and now we're almost back to kind of the full swing of things. But as I believe I may have mentioned earlier, one advantage that we have some scale. So, we have systems in place. So we use scheduling software that allows us to do a lot of these things virtually. So regardless of whether we had that interruption with people coming into the office or not, the scheduling was quite seamless. So thankfully, during the whole period, it's for our particular industry, maybe that other people sometimes have a difficult time understanding is that you have to be hiring and training and orienting people regularly. So it's really, on top of the scheduling, it's being able to grapple that piece. How do you do that kind of like in amidst a pandemic? And I think for those companies that can have an infrastructure and a setup in place where they can make that happen, find the right people, the right caregivers, the right workers to do this work, get them screened properly, as that's very important, get them trained properly, and then ultimately kind of like, put them and match them with the families that need them. That's really key during this time.
Thank you. And Jen, I'm just curious from Safe Care BC's perspective, in all your help of many organizations, I'm sure you've heard lots of questions and comments and requests for help on this in this area. What do you think about this?
You know, in a lot of ways, this is a sector that has been incredibly resilient and incredibly creative. So, I mean, there have been some major challenges, and we've talked about those. But one thing that's really come to the forefront is just the incredible sense of community coming together. And I can give you a few examples. When we launched Operation Protect, we had about 5 days to stand up a province-wide distribution network and collection network for PPE. There's no way we could have done that with the help of volunteers. And some of those volunteers came from our home health members. We had home health members step up and open up distribution nodes for PPE on the island for us, for example. And so it's just one example of many. We've heard stories of organizations fostering direct relationships with their local pharmacies so that they can have a secure or a new supply of gloves and masks. We've heard of organizations, home health organizations, connecting with their local distilleries so that they can get hand sanitizers. So, to me, that just really speaks to the resiliency and the creativity of this sector. And for all it's been challenged, I think there's some pretty incredible people who work in home health, and it's really a privilege to be able to serve alongside them.
Thank you, Jen, and thank you to everyone on the panel. It's been a great conversation of lessons learned in the home health sector. And when we reflect at the Alzheimer's Society BC, reflect back on many of the questions that we hear on our dementia helpline from people living at home. They really rely on the supports that are around them and help them feel confident and not so frightened about how they're going to manage this. And hearing you all today, it is just resounding, the words like resilience and relentlessness and care and innovation and relationships, all those words that our families really hold to help them through. And I thank you very much for all the care you've done and the continuation of doing what I know you will continue to do as this pandemic goes on. It's important to look at the lessons and reflect backwards and to understand how that can make things get better. I reflect on Bonnie Henry saying that 4 months later, we have more information and more knowledge, and that will mean that the way that we respond to things will be different. But as long as we keep people and their care and the quality of their life at the center of that, we will be making the best decisions. And that is resoundingly clear in all the stories that you are sharing today and the lessons that you've learned and the commitment of those who work in the home health sector. So thank you again to everyone for listening in to this panel, learnings from home health. Thank you very much to BC Care Providers for hosting this panel and this conference. There are lots of really interesting other conversations that I hope people will be tuning into. And again, thank you for the time today and the questions that have come in through the chat pod. And I wish you a happy conference. Thank you.